Going into the pelvic floor practice, was as a male practitioner, was there any qualms or any doubts in your mind, or were you worried that not many people might need or see you for pelvic floor rehab?
I get that question a lot
Mm-hmm.
actually. And when I started out, honestly, I guess because I was naive to it.
Mm-hmm.
I don't know. I like to think that I give off a very non-threatening or, a very friendly vibe personality. So it never really kind of was in my head that people may
Mm-hmm.
not come to me because I'm a man.
Mm-hmm.
Um, but through clinical practice, I've only ever had, I mean, and I don't know what goes on behind, closed doors when people are scrolling on the internet trying to find a provider. Like, I don't
Mm-hmm.
know what's going through their thought process, but at least in front of me, the patients that I've had, I've only ever had one patient that she didn't refuse services or therapy. She just refused to, she declined an internal exam and
Mm-hmm.
she just wasn't comfortable with it. And I said, that's fine. We can, treat it in other ways.
Mm-hmm.
But outside of that, I haven't had any sort of kickback
Mm-hmm.
for being a male provider in pelvic health.
Mm-hmm.
I will say, and I don't know again how naive this is of me or not, but I'm openly gay. I have a partner that I've been with for 5 years. I talk about him open and freely, and I'd be remiss if I didn't admit that I think that plays a part in,
Mm-hmm.
the female level of comfort, being feeling comfortable with
Mm-hmm.
me. I think that, at least outwardly, I don't necessarily project a very heteronormative, type of way about me.
Mm-hmm.
I feel like being open about being gay, and I make it very clear on my website and my referral, I have a large referral network of like sex therapists and mental health therapists and massage therapists and some urogynes and OBs, and most of them know me on a professional level, but also on a personal level. And so there's a lot of, I guess, gatekeepers before patients even get to me
Mm-hmm.
that A, I'm a man, B, I'm gay, and C, I have a doctorate degree that says that I can do what I do. So
Mm-hmm.
I've never had any kickback,
Mm-hmm.
fortunately, thankfully. Patients
Mm-hmm.
have, if they're coming to me, it's because they want to come to me and
Right.
they feel comfortable seeing me,
Mm-hmm.
thankfully, fortunately.
So having that network is really good. So how did you build up that network of doctors, practitioners around you in your practice?
Honestly, it's just kind of pounding the pavement.
Mm.
Well, for one, there's not a lot of male, as we've been discussing, there aren't a lot of male providers doing
True.
pelvic floor physical therapy.
Mm-hmm.
So, especially on the East Coast, like I mentioned.
Mm-hmm.
So, being one of a few,
Mm-hmm.
it kind of not raises eyebrows, but, perks some ears up whenever they hear there's a man treating pelvic floor dysfunction.
Mm-hmm.
So, it's kind of like a wow factor that's
Mm-hmm.
really helped. So talking to different people, going around being like, hey, this is who I am, this is what I do, this is the population of people that I can treat.
Mm-hmm.
If you have anybody that fits into this X, Y, or Z diagnoses, like
Mm-hmm.
they may benefit from therapy.
Mm-hmm.
So when I first started, and don't get me wrong, this has been a buildup of the last 4 years to get me
Mm-hmm.
to where I'm at right now. But when I first started, it was a lot of going and marketing to different people, different providers, chiropractors, massage therapists, doctors, nurses, nurse practitioners. So anyone that sees anyone with pelvic floor disorders, I was going to and introducing myself and passing out business cards. And so I've been at various employers and various clinics before, starting my own practice where I'm at now. And throughout all of that, I was kind of going and just meeting people. I love to network. I love to
Mm-hmm.
talk to people and kind of give people an idea of who I am and what I can do. And so that's sort of how I built up my network just over the last couple of years, just really pounding the pavement and meeting new people. Every patient that I get, whether it's a referral or somebody just finds me off the internet, I'm constantly asking, like, how'd you find me?
Mm-hmm.
Who are you? Like, who else is in your care team that is helping you through this? And so if it's somebody that I haven't met, I'm reaching out to those people that it's, it's all about networking. It's all
Mhm.
about who can help, who are like-minded individuals that can help you, that are seeing the same clients as you.